This chapter tackles the difficult and widespread problem of fever and its causes. The IMCI guidelines take a systematic approach, which in most cases will lead to a successful outcome.
A child with fever may have malaria, measles, or another severe disease. Or a child with fever may have a simple cough or cold or other viral infection. Malaria is caused by parasites in the blood called plasmodia. They are transmitted through the bite of the Anopheles mosquito. 4 species of plasmodia can cause malaria, but the only dangerous one is Plasmodium falciparum. On the chart and in IMCI guidelines, malaria refers to falciparum malaria. Fever is the main symptom of malaria. It can be present all the time or go away and return at regular intervals. Other signs of falciparum malaria are shivering, sweating, and vomiting. A child with malaria may have chronic anemia with no fever as the only sign of illness. You will hear more about anemia in another section. Signs of malaria can overlap with signs of other illnesses. For example, a child may have malaria and cough with fast breathing, a sign of pneumonia. This child needs treatment for both falciparum malaria and pneumonia. Children with malaria may also have diarrhea. They need an anti-malarial and treatment for diarrhea. In areas with very high malaria transmission, malaria is a major cause of death in children. A case of uncomplicated malaria can develop into severe malaria within 24 hours after the fever first appears. Severe malaria is malaria with complications such as cerebral malaria or severe anemia. The child can die if he does not receive urgent treatment. To be sure that a child with fever or history of fever has malaria infection, you need to do a malaria test. There are 2 ways of doing a malaria test. Either examine a blood slide for malaria parasites using a microscope, or checking blood using a rapid diagnostic test, RDT, for malaria antigen. The test should be done in the following children: all children from a high malaria risk area with no danger signs or neck stiffness, all children with fever and no general danger signs and no apparent cause of fever from a low malaria risk area. Look for other causes of fever. A stiff neck may be a sign of meningitis, cerebral malaria, or another very severe febrile disease that needs urgent treatment in a referral hospital. Check for neck stiffness. Look to see if the child can bend his or her neck himself. Gently bend the neck of the child towards his or her chest. If there is resistance to bending, the child has a stiff neck. Look for runny nose. In a low or non-malaria risk area, a child with fever and a runny nose may probably be suffering from a common cold or pneumonia or ear infection. Measles with complications. A child with measles now with fever, runny nose and a rash was presented earlier in the EPI module. However, a child who has had or still has measles may develop mouth or eye complications. Other complications include stridor in a calm child, pneumonia, diarrhea, malnutrition, and ear infections, and these are addressed elsewhere. Look for mouth ulcers. When present, ulcers make it difficult for a child to drink or eat. Look for clouding of the cornea. The cornea is the black part of the eye, and it is usually clear. When clouding is present, the cornea may appear cloudy and hazy. It may be as a result of vitamin A deficiency, and if not treated urgently may cause blindness. A child with clouding of the cornea needs urgent treatment with vitamin A. Look for pus straining from the eyes. This is a sign of conjunctivitis resulting from an infection of the conjunctiva. It can appear as pus straining or can form a crust when a child is sleeping and seal the eyes shut. A child with these signs could have a very severe illness and needs urgent treatment and referral. Give the first dose of pre-referral antibiotics for meningitis or other severe bacterial infections, and an antimalarial if from a malaria risk area, and refer urgently. In previous years, chloroquine and sulfadioxine, or SP, were the first-line and second-line antimalarial drugs recommended in the IMCI guidelines of many countries. More recently, malaria case management has been greatly affected by the emergence and spread of firstly chloroquine and increasingly SP resistance. WHO now recommends the use of artemisinin-based combination therapies, ACT, which have been shown to improve treatment efficacy. The advantages of ACT are that it can very quickly reduce the number of malaria parasites and improve the symptoms. If the fever is high, that is greater than 38.5 degrees Celsius, give paracetamol. Advise the mother to return for follow-up in 2 days if the fever persists. If the fever lasts more than 7 days, they should be referred for further assessment. Children with severe complicated measles should be urgently referred to hospital, as the complications may lead to death. Treat a child with vitamin A and give a first dose of antibiotics, then refer. If a child has eyes or mouth ulcers, treat the child with vitamin A and teach the mother how to treat the child's eyes or mouth ulcers at home. If a child just has measles only, give vitamin A to help prevent measles complications.